So this session is about modeling for future pandemics. We are going to have 4 presentations. We get started with Edward Holmes from the University of Sydney School of Medicine. So, Edward.
Good morning, thank you. So I'm from Australia, so I've gone for a ridiculously optimistic title. Apologies for that. And I'm only going to talk really about the basic science of this problem, nothing else. Because as you well know, you should know by now, if you mix science and politics, you get politics, right? So this is just going to be basic science. What I want to do to learn about what we might do for the future is take you back to the last pandemic and some of the lessons we learned from COVID-19. So you may have heard some of this before, but I apologize for that. So I just want to talk about exactly how the first cases were discovered and how we got the kind of first data. It's a little timeline here, so it's small, but the first reported cases in Wuhan were in December 10th, 11th, 2019. The doctors in Wuhan actually did an amazingly good job. They saw there was a cluster, they were on it pretty quickly. Their diagnostics failed, so they then sent their samples to a company in Guangzhou called Vision Medicals. And within 2 days, they had sequenced the genome of the virus. That was the first genome sequence. Quite amazing, actually. The company then told the hospitals in Wuhan and the China CDC what they have found. So this is actually an important point. So the CDC was greatly expanded after SARS-1 to try and make it a better response, and they claimed they could recognize any disease within 24 hours. They were actually told it by an external third-party company, which is quite an important point to recognize. Then a second company in Beijing, genome company called the BGI, also sequenced the virus from the patient a couple of days later. And one of the workers at the BGI then posted online on Chinese social media the report of what they had found, saying they'd found evidence of a SARS coronavirus in the samples. And that's when all kind of hell broke loose in China. It became public knowledge. A few days after that, the Chinese government, in the guise of the National Health Commission, put a set of guidelines online. In fact, it's still there, you can read this, but what to do. It was actually called a gag order because although it wasn't totally repressive, they did make some quite restrictions on who could share the data, how you could share the samples, and what you could publicize. So that's when where science, politics kind of kicked in first of all. So I was involved and the genome sequence data, though it was sequenced on the 27th of December, was not made public, okay? So I became involved on about January the 1st. I told my colleague, Professor Zhongzheng Zhang in Fudan University in China, what was available in the public domain. He then got 7 patient samples from Wuhan Central Hospital. We had a collaboration there. They were sent him on a train from Wuhan to Shanghai. They arrived, and his lab was January the 3rd. By sending him on a train, he actually broke this gag order. He broke the public health rules and was punished for that quite severely. I can discuss it offline if you want. 40 hours later, January the 5th, he'd sequenced the whole genome. So a number of groups were sequencing it very, very quickly. It's quite incredible. We then talked about what to do. On January the 5th, the same day as he sequenced the genome, he contacted the Chinese Ministry of Health. You can see this letter there to them. And basically the letter says, this is a new coronavirus. It's going to be respiratory because mammalian coronaviruses are respiratory. So we knew that right from the get-go. That didn't need anything else. That was obvious. And that people should take precautions. And then I posted online the first sequence on the evening of January the 10th US time. Now, the reason why I posted that sequence out, that's the first one, was we wanted to get diagnostics going quickly, wanted to get PCR tests, and that was done very quickly. What also happened, which I didn't realize was going to happen, was that the first vaccines will be designed so incredibly quickly. You've already heard that today from 2 talks. Very briefly, though, so the sequence was released on Friday evening, US time. By the Monday morning, Moderna NIH scientists designed the first vaccine. So 48 hours, quite incredible. Okay. So that tells us a bit about the response. We also know what drives the COVID, tells us what drives pandemics. Going back to this famous Huanan market in Wuhan, I was there in 2014. I took some pretty terrible photographs. If I'd known how important they'd been, I'd done a better job, I apologize. The ones at the bottom are mine. You can see there's some raccoon dogs in there. The ones on the top are from some people in 2019. You can see various wildlife being sold there. So you've got raccoon dogs and marmots. Raccoon dogs on the left. And then when the market was closed on January the 1st, the store hold has been tipped off, all the wildlife have been removed, but the team investigating went in, they swabbed surfaces, door handles, freezers, fridges, bench tops, drains, and then it was then tested for the virus and sequenced. And what you're seeing there are the maps of the market. There's two sides, a west half and an east half. And if you look at where the positive samples were and the positive sequences were, they all fall in the southwestern corner of the market. And the genomic data has told us that the virus, and that's what you're seeing in the kind of picture there, the virus was there. Also, there's a whole bunch of wildlife was there. Even though the authority told us there was no wildlife, there was lots of wildlife there. Civets, raccoon dogs, you can read it, marmots, whatever. And by great coincidence, when I was there in 2014, I took a photograph of one particular store. That's my photograph. On the top of raccoon dogs, below it are ducks. That's the same store that had the most hits for virus and animal. So this is a long-running trade that's been going on in this particular market. And it's just like SARS-1. SARS-1 was a wildlife market in Guangdong province. This is in Hubei province. The same thing was going on. Okay, and so the reason why these markets are a risk, because what you're seeing here is two different industries coming together: game food, so wildlife use of food, and fur-farmed animals. And these both pose, I think, the biggest risk for future pandemics. So looking at game food first, this is kind of wildlife that's used for food. So after the outbreak started and the markets were closed, but there are these breeding farms where the animals are bred, wildlife's bred before it goes to the markets. My colleagues in China went and sampled some of these wildlife farms to see what was there in these animals that then went on to the live animal markets. So on the left there, you're seeing, top left, that's the menu board of live animals that would have been sold in these markets. Then next to it, you're seeing animals that we actually sampled at these wildlife breeding farms. Here we've got raccoon dogs, that's the white animal in the corner there. We've got marmots, we've got Asian porcupines, we've got civets and bamboo rats, whatever, okay, a whole bunch of things. In doing that, so we sampled like 2,000 animals, and we found 21, in those animals, 21 viruses that we think are risky because they're jumping species boundaries. That's zoonotic, that's what Tony told you at the start. That's the process that drives pandemics, and there it is happening in these wild animal breeding farms that then seed markets. Just to kind of put it into context, so including the alpha coronaviruses and avian flu viruses in these animals. So I'm going to show you some quick videos. This is an Asian badger. They were actually one of the ones we sampled in one of these breeding farms. And if you look at its nose, see that? That's avian flu. That's H9N2 avian flu. Okay, this is now a raccoon dog. This video, the sound's not working. It's coughing. It's had a respiratory disease. These are fur farmed, and they're kept as food as well. And the third one, I apologize for this, is lunch is coming up. These are juvenile raccoon dogs with a gastric hemorrhagic disease that's actually caused by canine coronavirus. And the person's handling it with no gloves, as you can see. So this is the process that drives pandemics. Okay, the conditions are poor. They're crowded together. They're on top of each other. There's poor hygiene, and then they're being passed on to live animal markets, often sick. Okay, so this is no surprise these pandemics take place. So that's game food. The other industry is fur farming. Sorry, this is very small. This is showing you the value of different industries in China. You can see the size of the biggest circle there. That's the fur farming industry. It's absolutely an enormous industry in China. And it's, again, I'm not just picking on China. Other countries do this as well. China is actually one we've got the most data from. So then with colleagues, we investigate the fur farm industry in China. There are 4 species that are kind of mandated by the government to be fur farms. That's raccoon dogs, 2 species of foxes and mink. They're mainly farmed in northeastern China. That's the biggest kind of pie charts there. So we sampled about 500 or so animals that had died of infectious disease. There's a list of species there. And it's not just these 4 animals that are being farmed. It's a whole bunch of them, okay? It's a whole zoo of animals that's being fur farmed. And again, we found lots of novel viruses that were jumping between species. Again, that's the process that drives emergence. There it was going on in these animals that then end up being exposed to humans. And of the ones we found, I'll just mention 2 of interest. One is this alpha coronavirus one. That's the canine coronavirus, just on the previous slide. killing off the raccoons. That's a nasty virus. It's got into humans, it's actually got into a variety of other species too, so that's what we need to worry about. And the second one is this bat HKU-like virus. That's a coronavirus. It's like MERS. It was in mink, causing pneumonia in mink, and it uses the human ACE2 receptor. So that's a big red flag. Again, in a wildlife setting that would then be exposed to humans. This, again, is a driver for pandemics. So what I've learned from COVID, just very quickly, before I go on, is, this human-animal interface that drives disease emergence. And game farming and fur farming is right at the interface. That's the kind of process we need to worry about. That's a picture of what I showed you. I'll discuss this more in a second, we do need some kind of global radar to monitor this process, to see what's there and what's jumping boundaries, okay, species boundaries. I'll discuss that in a sec. Obviously, as we've mentioned already, we need continued research and funding into vaccines and antivirals. The three groups of viruses that I think are most pressingly worrisome are coronaviruses, influenza virus, and paramyx viruses, because they are all respiratory. And it's the respiratory ones that are most likely to go pandemic. Okay, I won't mention that. I'll skip on a little bit. Data sharing was critical. It's critical in COVID-19. I was involved in that. So that process, you can have all the fancy vaccines and antivirals you like. If you don't share your data, it counts for nothing. So this is absolutely the crucial first step. Open collaboration, much the same. Governments need to listen to interested scientists. On that respect, science must be depoliticized. In context, myself and some co-authors wrote a paper on COVID origins, for which we have been endlessly attacked by particular governments, absolutely relentlessly. I was invited to fly to Washington at my own expense to be harangued by the Senate for 3 hours. I politely declined, but two of my colleagues had to go, and the Senate very kindly left my place tag there just to see that I didn't turn up. So this is insane. This is why people don't. Scientists are not going to share their data. They're worried they'll get persecuted. Right. So. A critical thing, I do think we do need to have some global surveillance systems. It's kind of obvious, right, to work in this space. There was a suggestion to make this radar after the G7 conference in 2021, it was, in Cornwall. That didn't happen, maybe because Boris Johnson, I don't know. It didn't really get off the ground. What they did do, which is very good, they did make in Berlin this WHO hub, which has actually been pretty useful. And it's got a very nice genome sequencing surveillance service that's now globally set up, which is good. But that's still not exactly the same as a radar. It's kind of one step further down the line. And to me, it's not difficult to work out what we need to do here. We need to look at this human-animal interface. Things like the wildlife trade, fur farming, animal production, slaughter, bushmeat. These are the areas where people get exposed. That's where we need to look. And the tools to look are actually really simple. We have them already. We can do targeted serology, some very cool tools that like ViaScan now, or you can do metagenomics. That's the kind of thing I do on a daily basis. The science is not difficult. It's actually quite straightforward. Okay, it really is. So, steps towards pandemic prevention. I've really gone through this very quickly. First off, we need to reduce interactions between ourselves and wildlife, because that's what drives pandemics, okay? And again, I've mentioned fur farming, live animal markets, and deforestation is also a key part of this, right? That exposes us more. And there are plenty of humans who are not diseased we can relate to deforestation, HIV being one, for example, very clearly, okay? And as climate change goes on, this is all going to get far worse and just kind of get put on turbocharge. We need to build capacity in low and middle income countries. They need to be able to do their own sequencing. They need to do their own surveillance. That's absolutely critical. It can't just be the Western countries doing this. We need to build infrastructure. The hub is doing some of that, but that needs to be expanded. Again, we need this kind of global radar. We talked about it a lot, but it still hasn't quite happened. And again, the science I think behind it is pretty easy to do. Once you then do the genetics and find a virus, you can then do various risk assessments to work out which viruses are the ones most likely or not to emerge in humans. And this process of risk assessment is actually pretty straightforward, okay? And I've written there some of the evidence that you could use to say, is a particular virus you found likely to emerge. So does it use human cell receptors? Okay, for example, is it already jumping in between species in the wild? They're all kind of risk factors. So that we know those things quite easily. And then once you do find something like that, we need to have a platform for open and immediate data sharing. We haven't got that at the moment. Unfortunately, I think things have got worse since COVID-19 because the scientists have been vilified and there's a horrendous blame game going on about who's responsible for this. And that's actually just made it worse. It really has gone backwards, unfortunately. And of course, then once we have this again, we need to make preemptive vaccine design, and also to limit the risk behavior if it's for example, to do with fur farming, then that can be limited. And just again, to emphasize my last point here is I do think the science behind it is actually pretty straightforward now. So with new genomic technology, we can very reasonably expect to identify the cause of any disease outbreak within 24 hours. I don't think that's hard, and I think it's actually quite straightforward. The sequence is very good. And then another 24 hours onwards to design an mRNA vaccine. That vaccine may not be the one that actually used, but the design of it is pretty quick. So 48 hours, I think we could do all that, which is really quite remarkable. So tech is there. Unfortunately, the politics are limiting us from doing this. Thank you.